Hi, I'm Naomi Fox, Director of Education for ANPD.
And I'm Mary Smith, ANPD's Education Program Manager. And today we're going to talk about ANPD's 2022 Learning Needs Assessment. Before we talk about our findings, let's review how the Learning Needs Assessment fits into the bigger picture of environmental scanning. A learning needs assessment can follow a larger needs assessment as an NPD practitioner or an organization engages in environmental scanning to understand threats, opportunities, and identify potential professional practice gaps. ANPD's Nursing Professional Development Scope and Standards of Practice and ANPD's Core Curriculum for Nursing Professional Development are resources that explain these assessments and resources I often reference in my own work as an NPD specialist. Recently, ANPD conducted a learning needs assessment to understand our members' learning needs and guide educational topics that can be offered. In recognition that the learning needs assessment is one tool in the NPD practitioner's tool bag, we are also leaning on our overall environmental scanning to understand opportunities to further support the ANPD community. We would like to point out that we are sharing our survey results with you today as raw data, and that some survey questions were not completed by every respondent. We are continuing to analyze this data as we plan for 2023 and beyond. The Learning Needs Assessment allowed us a window to understand three main categories of information about our community: demographic information, what respondents identified as educational needs, and how our community has engaged with ANPD by participating in activities and using ANPD resources. We received more than 1,300 responses, which included mostly ANPD members, but also included non-member responses that allowed us additional insight into the NPD community in general. So we'd like to start by sharing our demographic data. We garnered details such as ANPD membership status, education, certifications, and also details such as age, gender, and ethnicity and race. We also learned about respondents' work environment and their organizations. Some of this information we were able to compare to data from the last published National Nursing Workforce Study conducted by the National Council of State Boards of Nursing and the National Forum of State Nursing Workforce Centers. The 2020 study included more than 42,000 RN respondents of the more than 4 million registered nurses currently licensed in the U.S. While we were also able to note that there were differences in responses between the ANPD members and non-members, we also recognized that we received more responses from members than we did from non-members. We asked our survey respondents about their NPD experience specifically, and not their years of RN experience. And as you can see, most of our respondents have more than 5 years of NPD experience, and 52% of respondents having 5 years or less. When we looked at this data from members and non-members, it becomes more clear that ANPD member respondents tended to have more experience in NPD than our non-member respondents, with 51% compared to 34% having more than 5 years of experience. We asked about national nursing certifications in nursing professional development, clinical area certifications, and non-clinical certifications. This was also a select all that apply question. We did note in data from the American Nurses Credentialing Center that there has been an increase in the number of nurses certified in NPD, rising to 4,925 nurses in 2021, nearly a 26% increase since 2017. Many of our member respondents shared that they are certified in NPD, and many are certified in a clinical specialty area. We did note that our non-member respondents had more clinical specialty certifications than certification in NPD. The Learning Needs Assessment did not limit the highest degree obtained questioned to nursing degree only, and instead asked about the highest degree. Most of our respondents cited having graduate degrees. In looking at our survey respondents' age, 84% fell between ages 35 and 64. We look to compare these responses to the National Nursing Workforce Study. And it's a bit harder to compare the 25 to 34-year range, as that study used the ranges of 18 to 29 and 30 to 34, which together totaled 17.9%. But because there is a difference in ranges, they're not shown in this chart. And as you can see in the comparison, more of our survey respondents fell into the 35 to 64-year-old range than the national study did, with less reporting being older than 64 in our responses. We asked about gender and included a link to gender identity terms. And in this survey, none of our respondents selected transgender, unsure, questioning, or preference to self-describe. This did vary slightly from our results from another recent diversity and inclusion survey from ANPD, which we'll be sharing in another discussion. Most of our respondents cited being female, with 3.1% citing male, which is less than that of the workforce study results. In terms of our respondents' race and ethnicity identity, 4.6% declined to answer. Respondents were able to check more than one selection. Of those who responded, survey results were similar to that of the National Nursing Workforce Study in terms of citing Caucasian. However, the National Nursing Workforce Study did recategorize responses that selected more than one race category, and they also separated ethnicity into a separate question, so comparisons are challenging to make here as well. We also asked our respondents about their role. We recognize that oftentimes those working in the NPD specialty wear many hats. So for those who had dual roles, we asked where most of their time was spent. Most of our respondents identified as being non-supervisory NPD practitioner or NPD specialist in a centralized, unit-based, or combination department. Nearly 21% reported a formal leadership role, and 2% noted a role in academia. 3.7% of survey respondents indicated a professional development associate role. When comparing this to other data points in the survey, such as holding an NPD certification, it is possible that some respondents may utilize the PD associate definition other than the definition by ANPD that you see here. As by ANPD's definition, PD associates are typically not RNs or NPD practitioners. Nearly 10% of our respondents chose other for the role. In examining free text responses, about 20% of these likely fell into other defined roles, such as NPD Central Department. And as you can see here, of those who cited other as their role, some noted their work setting, such as a health system. Some noted a service line at a site or system level, and examples include oncology service line at multiple locations, or ambulatory, or all adult med-surg units, or peds home health, multiple sites. In asking about their work setting, respondents were able to choose all that applied to them. Most respondents identified as working in a hospital setting, whether it was an academic medical center, community, rural, urban, VA, or military hospital. These totaled 88.5% for hospital responses, but again, check all was an option. Other information included 24% working at a magnet accredited institution, 30% in a multi-site organization or system, 7% representing academia, and an additional 8% reporting home health, hospice, inpatient rehab, or long-term care. For all work settings, 14% cited working from home either part or all of the time. 56 responses, or about 6%, cited only one NPD practitioner in their organization. Most landed between 11 and 20 NPD practitioners, but as you can see, the distribution of responses varies between 2 to 5 and 21 to 50. While we recognize that typically the more staff that are supported, the more NPD practitioners there will be, we also recognize that each organization may structure their NPD departments and roles differently, and wanted to provide the opportunity to share as much information as possible about their work and that of their organization. Here we see that 43% of our respondents reported that more than 2,000 staff were supported by NPD practitioners in their organization. Additionally, 54% reported supporting non-nursing healthcare professionals. We know this is not surprising, as Dr. Mary Harper and her colleagues noted this on the organizational value of nursing professional development practice findings from the 2021 study, which also reported that NPD specialty support routinely expands outside of registered nurses. Here are some staff supported by our survey respondents. Many responses were reflective of supporting assistive nursing personnel, diagnostic professionals, OR professionals, and therapy professionals. I'm now going to hand it back over to Naomi to discuss the education needs identified by our survey respondents.
Thanks, Mary.
The second section we're going to discuss is the identified education needs. The LNA was categorized by NPD roles reflective in the NPD practice model. These are learning facilitator, change agent, mentor, leader, champion for inquiry, advocate for NPD specialty, and partner for practice transitions. This develops into 63 unique topics presented, divided by the 7 NPD roles, with an opportunity to free text additional topics. A Likert 5-point scale was used to identify personal needs, ranging from not needed, I do not need this education, to most needed, I need this education and it is a priority. This is an example of the amount of data we analyzed for results. We have this information for each role. So for this example, for learning facilitator topics, we asked about needs for adult learning principles, educational design process, incorporating learning styles in education, interprofessional education, simulation, teaching strategies, and utilizing technology. Not pictured, but also asked in this topic were NPD orientation and onboarding, general onboarding and orientation, and PDA onboarding and orientation. We then can take the top 3 rated topics selected as needing education on this topic are teaching strategies, interprofessional education, and educational design process. And so we did this for each of the 7 roles. We asked an other needs category and added this to incorporate topics from our own environmental scanning. We took the highest percentages of needed and most needed to add to our list of identified needs. The topics we asked about were behavioral health care outside of behavioral health setting, ethical issues, gender inclusive and gender affirming care, legal issues, mentorship programs, multi-site systems NPD work, the role in diversity, equity, inclusion, the role in retention and turnover, the role in working with travel agency nursing staff, NPD standards of practice, resiliency self-care for staff, and resiliency self-care for the NPD practitioner and PD associate, systemic structural racism, using social media in NPD work, workplace violence, both lateral and with the patient visitor. We felt these topics are important to assess because they otherwise may be missed during traditional post-education evaluations. We consolidated all of the data and are focusing on the top 15 overall reported needs. The darker purple text indicate topics that we have already scheduled for webinars or currently have education resources for these topics. The lighter purple, we are in the process of evaluating previously made content, sharing with our NPD committees for ideas for new content, and looking for contributors on these subjects. Again, the topics are related to technology, the role in retention and turnover, return on investment, transforming processes at different system levels, competency documentation, simulation, new nurse leader programs, fostering innovation, project management, advocating, strategic planning, professional growth, legal issues, evaluation of learning needs and outcomes, and multi-state systems NPD work. Other patterns of expressed needs were identified as NPD in long-term care, generational needs in NPD, tech used in healthcare and NPD, e-learning best practices, post-COVID learning needs, and nurse planning and CPD planning. We wanted to know if you would be interested in a mentorship program. 79% of you indicated interest. This picture is of my dogs, Lincoln and Winky Bach. Lincoln's the larger dog and Winky Bach is the baby. This is a picture of Winky's first walk outside on the ground. She needed someone to help guide and support her as she experienced something new. Having Lincoln by her side and helping her by him role modeling how to walk outside increased her confidence. Not only did Lincoln's support benefit Winky Bach, Lincoln also grew in his own way. Your free text comments highlighted the need and desire to want to participate in a mentorship with an emphasis on introducing a human connection within our community. Formal effective mentorship programs are definitely a challenge due to a need for commitment on both parties, matching, dedication, validation, and evaluation. We're going to work to develop something for our community of NPD practitioners that's both meaningful and effective.
The third section of our learning needs assessment asks questions about ANPD resource utilization. This section of questions inquired about any respondents who have engaged with our products and services or who are interested in our products or services. We want to know, have you used our products? And if so, what were the reasons? If you have not, additionally, what were the reasons? Reasons identified for utilization of our products is 94% personal or professional interest, 48% needing continuing education credits, and then the remainder high number was organizational support. There was another category, comments indicated to learn about my profession since there aren't many resources at my hospital. And the second one was because the organization is, quote, my people, end quote. The if not reasons were due to schedule conflicts, unawareness of products and services, lack of organizational support, and unsure of which products are appropriate. So throughout the remaining year, our goal is to really emphasize which products are appropriate for which level of competence for the NPD practitioner, and to also really kind of get our products out there so that they can help you in your role. We asked about what is the preferred day and time of live and synchronous offerings. The preferred day was very similar across the working week, with the highest preference on Wednesday and Friday. 1% did indicate a Saturday or Sunday. Webinars are recorded and available for anyone who really utilizes that weekend to kind of get in their professional development and Con Ed. The preferred time is 29% indicated early afternoons from 11 to 1 Central Standard Time. 9% indicated they'd like to see some evening offerings, and 25% indicated the afternoon 1 to 5 p.m. Central Standard Time. Our goal is to flip the schedule at some point in the year and offer a live webinar in the afternoon. We'll definitely communicate that at the time, and then we'll evaluate to see if that time frame was better for our members. We also want to know with what products are respondents engaging with. The survey was sectioned by live, synchronous, and hybrid programs, online education and offerings, website resources, and our ANPD books and publications. Respondents' options were yes, I have used these, no, I have not, no, but I'm interested. This explains our most engaged responses, meaning yes, I have used or currently use this resource. Number 1 was live online webinars, followed by recorded webinars, nursing professional development scopes and standards, ANPD convention recorded sessions, core curriculum for nursing professional development, any scholarly work and research, our certification preparation courses, NPDM motion, which was formerly known as trend lines, position statements, discussion papers. When assessing which live synchronous programs you're interested the most in, number 1 was, again, webinars. We're planning to have about 14 webinars for 2023. The second was certification preparation courses. We have both live courses that we jointly provide on site, and then we also have virtual courses that take place over the course of 4 days virtually. The NPD Leadership Academy was the third. NPD Leadership Academy is launching its newest cohort at the convention and finishing up with the cohort from 2022 to 2023 currently. This is a leadership academy that's aimed to identify future or currently new leadership roles in NPD and to help support them throughout the course of a year and implementing a best practice change project. This is a mentored academy as well. So you are assigned with a mentor and then you get to connect with that person throughout the length of the year. The Evidence-Based Practice Academy came in fourth. This academy is also targeted towards NPD practitioners who would like to learn more about evidence-based practice while completing modules and live webinars, as well as check-ins, along with the mentorship that will ultimately assist them in formulating a PICO question, evaluating literature, creating a synthesis table, and again, engaging in an evidence-based practice initiative at their practice setting. Which programs are you most interested in if you have not engaged in them yet? Again, we're seeing common themes here: the NPD Leadership Academy, the Preceptor Program course, the EBP Academy, the EBP course, which is self-paced, Professional Development Associate course and tools. That's also a self-paced course on our learning management system, and it's recently been updated. And Transition to Practice course, which is also on our learning management system, self-paced, and has recently been updated. Additional products that you're interested in are Environmental Scanning Toolkit, Legal Aspects of NPD Practice, Educational Emergencies, Known Cost Tables, and the Human Resources Kit. We have more to offer you and want to remind you to keep an eye out for our updated product brochure. Our committee members, who are comprised of NPD practitioners just like you, are dedicated to updating free available website resources such as the Environmental Scanning Toolkit and the Clinical Education Matrix. Our physical book products include quick reference guides that cover a variety of topics to texts that contain a wealth of information authored by experts. Our updated scope and standards is a must-have for any NPD practitioner. We received 106 free text comments that will help us identify opportunities and develop strategies for improvement in order to provide our NPD community with education and the tools needed. Comments ranged from "How do I register for webinars?" to "How much I love ANPD." Collectively, we will utilize all of the results from the LNA responses to work to provide you with what you need. Thanks so much for joining us and hearing our summary about our learning needs assessment responses. We're looking forward to some feedback and comments and sharing any insights that you may have. Feel free to email info@anpd.org. And we're looking to also disseminate additional next steps through NPD in Motion, through subject matter experts presenting in our webinars, and through our NPD Forecast podcast. Thanks again.